Welcome everyone. Thank you for joining us today. I'm Teresa Marentet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Today we are reporting an increase of 14 new cases of COVID-19 in Windsor and Essex County. Of the 14 cases, 1 is a close contact of a confirmed case, and 3 are related to outbreaks, and 10 are still being investigated. We have had 12,696 cases since March of 2020. 12,028 cases are now resolved, and 304 people are active cases at this time. 40 confirmed cases are currently in the hospital, and 7 people are in ICU. Our community has lost 364 people to COVID. Unfortunately, we are reporting 9 additional deaths today. 6 people are from the community, a man in his 60s, a man in his 70s, 3 men in their 80s, and a man in his 90s. And an additional 3 people are from long-term care, a man in his 80s, and a man and a woman in their 90s. 231 deaths have occurred among residents and staff in long-term care and retirement homes. There are currently 11 active outbreaks in Windsor and Essex County. 5 are in long-term care and retirement homes. There are 3 community outbreaks, 2 workplace outbreaks, and a new outbreak at one of our hospitals. We are currently in Phase 1 of Ontario's 3-phase COVID-19 vaccine distribution plan. 10,247 individuals from Windsor-Essex County have now received both doses of a COVID vaccine. We are asking healthcare workers to visit our website at wechew.org and submit an application to volunteer at our mass immunization clinics once the broader distribution of the vaccine is available to all eligible residents in our community. Despite the beginning of the vaccine rollout, public health measures must continue. Stay home if you're sick, limit your close contacts to household members, maintain a 2-meter distance from others, wash your hands often with soap and water or use an alcohol-based hand sanitizer, wear a non-medical mask or face covering, cover your mouth and nose with a tissue or use the inside of your elbow when you cough or sneeze, and download the COVID Exposure Alert app at canada.ca. If you have symptoms of COVID-19, no matter how mild, please get tested by calling or booking an appointment online at one of the assessment and testing centers offered at Windsor Regional Hospital or Erie Shores Healthcare. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us. During February 5th morning broadcast, I spoke to the increased overdoses related to opioid emergency department visits and the number that we are seeing in our community. This led to Windsor-Essex County Health Unit issuing an alert to our community in response to these numbers. In follow-up to the alert, as well as to address the increased effects of this pandemic on our community's mental health, I would like to remind you of the many community resources and services that are available to help support your mental health and addiction-related concerns throughout these times. One such a service is that of the Mental Health and Addiction Urgent Care Center, MHA-UCC, that was opened as a response to COVID-19 by Hotel Dieu Grace Healthcare and the Canadian Mental Health Association, Windsor-Essex County branch. The Mental Health and Addiction Urgent Care Center will be moving from its current CMHA location on Windsor Avenue to Hotel Dieu Grace Healthcare Crisis and Mental Wellness Center at 774 Ouellette Avenue as of February 22nd. We would like to remind our community that the Mental Health and Addiction Urgent Care Center is a service option for those 16 years or older, or those who are experiencing urgent mental health or addiction-related concerns. An urgent mental health concern can look like a depression, anxiety, thoughts of suicide or harming oneself, overwhelming stress, addiction, or other situation that can cause a person to be in a crisis. A multidisciplinary team from these 2 organizations, Hotel Dieu Grace Healthcare and the Canadian Mental Health Association, including physicians, nurse practitioners, addiction workers, on-call Windsor-Essex psychiatrists, and mental health social workers will assess, deliver, and coordinate the most appropriate care for you. The Crisis and Mental Wellness Center, TSC, provides outpatient mental health and addiction services throughout the week. As always, crisis walk-in services are available 7 days per week from 8 a.m. to 8 p.m., where the team can make direct linkages to the MHA UCC services if required during the hours of 11 a.m. to 7 p.m. Further, the 24/7 crisis line at 519-974-4435 is also available to speak with a mental health professional. To see a full range of community addiction support services in Windsor-Essex, please visit our website www.wechu.org and click on Your Health, and under that, click Substance Use. Also, in order to share additional information about the ongoing risk of contracting COVID in Windsor-Essex, today I'm planning to share some additional details on where we have seen the COVID-19 transmission in the last 2 to 3 weeks. So this is what it looks like from overall in Windsor-Essex for where these exposures are happening. Majority of these exposures, as we can see, is we are seeing in all of these locations, but primarily the private residences is where we were noticing most of these exposure. Recognizing the fact that we were in a lockdown and under the stay-at-home order with not many opportunities for businesses or for other things to open up. So majority of the transmission was happening in those settings. And 76% of cases, that means 593 locations across Windsor-Essex that we are talking about. Despite that, we have already seen 6.3% of the businesses that was identified as the second highest location where some of these transmissions we are seeing. And when we're talking about the businesses, this include food premises, office spaces, restaurants, retail shops, etc. And then the rest of the exposures are listed there as well. Under the others category, which is none of this, but also could include exposure such as people carpooling together and then getting exposed to the virus based on that particular type of event. So breaking it down further into by municipality, similar picture, most of the exposure, what we are seeing is in the city of Windsor. And to put things into perspective, we had a total exposure location identified as 779 in the last 30 days, whereas the 445 unique locations were only in Windsor, and the rest of the municipalities had less number of exposure in this time. Breaking it down further by municipalities, Amherstburg, this is what it looks like. Predominantly still it's the private residences, but we have seen the other exposure location such as in doctor's office, and under the doctor's office it can be any doctors or dentists that are currently operating, and the exposure may have happened in that location. And then still businesses 3.7%, and then the rest of the category is in others. In Essex, similar picture, majority of the exposure in the private residences. A school is another significant exposure source that was identified in the last 2 to 3 weeks, followed by the rest of the sectors. Looking at Kingsville, similar picture, private residences most, but then 10% exposure in the business sector, and then in the farm that it also include the bunkhouses. That's where some of these exposures are happening in the town of Kingsville, and then some retirement homes. Lakeshore, similar picture, private residences by far the most, and then followed by businesses and the public school, and also the doctor's office. In LaSalle, this is what it looks like. Leamington, the only new addition in this one is the farm and also the supportive housing that the town of Leamington have, and that's where some of these exposures are happening. And lastly, in Tecumseh, A good number of cases are coming from the business exposure location and followed by the supportive housing. And then the rest of the picture is pretty much similar. And this is what the picture looks like in the city of Windsor with more diversity and more exposure sources. But the majority continues to be in the residential setting and followed by the business and then the rest of the sector. So that's all for today. I'm happy to take questions.
We'll now take questions from the media. Today we'll start with the Windsor Star.
Teresa, Doctor, do you know if any other instances of the any COVID-19 variants have been detected in Windsor-Essex?
So we have had 2 confirmed instances of COVID variant of concern that is detected. The third one is still under investigation because of some, I guess it does require some investigation before we can confirm. And in both those circumstances, as we reported earlier, were well contained, didn't result in any additional transmission so far. And all of those contacts are being monitored to ensure that no further transmission happened in our community.
And I know the very first case that was reported, it was not associated with any long-term care homes or vulnerable facilities. Have any of the other ones been associated with such sectors?
The other confirmed one is not associated with any high-risk vulnerable setting, and then the one under question is linked with the long-term care home. And that's why we're investigating to make sure that we get it right. And the initial indication is it could be a false positive, but we are investigating to make sure that that is the case.
What do you have to do to investigate that? Is it a matter of having the provincial lab tested again?
Well, we do reach out to the provincial lab to help us understand with the differences and with the clinical situation added up to the exposure source and all those details based on our case interview. And then in some instances, either they go back and look at how the tests were conducted and if there was any concerns identified from a process perspective. And once that is cleared, then sometimes we go ahead and we do a repeat test on this individual just to make sure that we're not missing anything. So all of those are part of the investigation, and as so far I don't have a confirmation, but it's currently being investigated, the third one.
Was that kind of investigation done for the other 2 instances?
No, the other 2 instances, based on the history and the case and contact management, it was pretty evident that there was no concern about that. But this third one, we did had some concerns based on the exposure history, based on the case investigation. That's what triggered the investigation.
Okay, thank you.
Any questions from AM 800?
Dr. Just following up on Taylor's question, is incident 1 and incident 2 associated at all?
No.
Okay, and when you talk to these individuals or your staff talks to these individuals, any idea how they got the variant? When did they travel outside our region?
In one, well, technically, I would be careful in what I say, but what I can say is in both the instances, there were some indication about connection with outside of the region.
I guess to that point, could they get in trouble? I'm not sure what term to use here because we were under a stay-at-home order.
Well, that's why I was just trying to be careful in how I frame that, but all I can say is there was no charges laid.
Okay, thanks for that. And then I just have a quick question about your presentation. Looking at the charts and obviously private residents, is that individuals that, I just want to clarify, is that individuals that live together, or could they have, for example, someone drop by, have company, I guess? What is private residence?
Yeah, no, private residents are generally the household contacts that we are concerned about. So I think that's why this identifies the exposure location. There may be some or two odd ones who may be visiting someone and then contracted it, but generally speaking, it's just the household contacts. That's even if you look at our data, most of these exposures that we are seeing is in the household contacts or close contact group, and under the household contact, it can be anyone who lived with you, and under the close contact, anyone you visited and then contracted it. But the exposure location continues to be in the house. Rather than in any other setting.
Any surprises in that chart when you were going through the numbers? I saw Tecumseh, for example, their private residence was fairly lower compared to other municipalities, but their business was higher. Anything catch you off guard when you looked into all those numbers?
Well, we do look at some of these instances, but we also know that it really depends on in any type of outbreak situation. So even if a workplace or if a business, if they have an outbreak with few cases, it can really drive the number up because we're talking about a short span of time. The data is representing from January 29th to February 17th, and it really gives you the flavor of what was happening in the last 2 weeks. So when people are making some of these risk-based decisions on which particular, let's say, establishments or area where they will be much more likely to contract COVID, that's the whole idea behind giving out this number. But the numbers will change in the next 2 weeks if we report. We may have a different number, but it does it gives you a different in terms of how each of these municipalities everything is happening in each of these municipalities. But overall, because we're all connected, doesn't necessarily mean that if the exposure is happening in Tecumseh in businesses, doesn't mean that the people living in Tecumseh were the ones who are getting the exposure or who are getting sick. It could be someone who's living in Leamington or LaSalle or Lakeshore, anywhere.
And then one final one here, just with this presentation, and I know you do your weekly summaries on Friday. Obviously, I focus on Windsor-Essex because that's our area, but from day one, it just seems like you and the team have been putting so much into this. Like I said, I'm not sure what other health units are doing, but just here locally, you and the team are working around the clock. And I know back when this all started a year ago, municipalities were asking for more information. And just with the presentation today, I guess just obviously it's important to share it to the community, but it just seems like you and the team are taking that extra step.
Thanks, Rob. You're so kind to mention that. And we try to present the information in the best possible way. It's not only just to throw that information out and without any context, without any understanding, and then it will be just the numbers and people can think about whatever they think. Our team has been really committed to protecting our community, and that's what we've been doing, and we'll continue to do that. And our epidemiologists working at the health unit, they're really great in what they do, and even the amount of data, the information that we use and we provide, and there were instances when we are sharing this information with the province as well. They obviously like it, the way that we all do use the evidence and then the data to inform our decision making. So obviously it does require a lot of effort, and we always try to look at innovative ways, creative ways to make more sense of the data, make more sense of the information, and to provide guidance accordingly to our community. And thanks to all my epidemiology team, they've been working really round the clock. Even last night, when I got this final presentation, it was late last night. So we know that they've been working really hard, and every one of us at the health unit have been working really hard to make sure that we are staying on top of everything that's happening in our community to provide the best recommendation, to take the best course of action for our community. And but it does take a lot of toll on us and to our team.
Thank you.
Any questions from CTV?
Yes, good morning. Just kind of following up on some of Rob's questions there and the presentation, what can be done to reduce the exposure in private residences?
Well, I think the household context, I think it's very difficult to manage, that how you do that, especially if you have a young family, children. It all depends on your risk level as well, right? So internally, even if I'm coming to my workplace and if I'm going back home, I want to make sure that I'm monitoring my symptoms very carefully. And the moment if I realize that if I am developing any symptoms, I want to make sure that I'm trying to immediately isolate myself from the rest of my family so that they don't get exposed. So that's how I would expect the community to do that. And then secondly, as we keep talking about again and again in terms of the household, sticking to your household as the only close contacts rather than getting anyone else in. Whether we are talking about friends, families, anyone else, it's not the time, and it just raises the risk. And especially when people are having multiple exposure sources, it is not a good idea. So if people want to be safe, stay close to your own household and do not get involved in any person who do not live with you. And then secondly, when you are staying within your own household, make sure that you're monitoring your symptoms, you're taking care of yourself, and if you have any symptoms, you get yourself tested, you isolate yourself with the rest of your family until you get you are cleared from the health unit, or if your test results come back negative.
Okay, thank you. And are there any updates on the investigation into the death of the retirement home resident after getting the COVID vaccine?
I don't have any information, so because that was the coroner was leading that investigation, and I haven't seen a final report from the coroner's office yet.
Okay, thank you.
Any questions from CBC?
Hi, good morning, Doctor. Good morning, Teresa. I had a question regarding the cases of the variant that have been discovered recently. Are they all the same variant, or do they involve different strains?
So we have only found the screening results for these variant. We don't have a confirmation, and I don't want to preempt any of this discussion before seeing the final results from the public health lab. They do need to do the full genetic sequencing before they can confirm which specific variant we are talking about. The screening test, it just tests at the highest level and just identify a few proteins that would be different than the rest of the virus. And then when the full genetic sequencing is done, they are in a much better position to comment whether it was the strain that was predominantly seen in UK, or it was a strain that was predominantly seen in South Africa. So we'll have to wait for that, and I haven't seen the final results, and my expectation is maybe it will come in next week, and when we get the final result, we will share that information.
Thank you very much. I also wanted to ask about whether there was an update on the outbreaks within our shelter system, and I was hoping you could elaborate on how these outbreaks are being managed, what agencies are involved, what support those groups are receiving from the health unit.
So just give me a second while I try to pull that information. But I can tell you, I can start with saying that there's a lot of there's daily outbreak call that's happening, and then there are daily calls with the partners that is happening. There are a number of agencies involved, obviously the mission itself, the health unit, and then the city, and also Ontario Health, EMS, our crisis response team that is established in Windsor-Essex, that's supporting some of these housing and other staffing support need for the region. So that is also supporting. So all of these partners, we talk about the next steps for the outbreak management, outbreak control directly with the operator. And we have an ongoing discussion in terms of the challenges with collecting all that information, making sure that the facility continues to be a safer place for the people who are coming in. Obviously, we recognize that there are a number of challenges with the facility itself, the population that visits, But there are a number of conversations that is happening daily with different people, and we are working together to make sure that all the needs are met. Any need for testing, any need for isolation, any need for infection prevention measures, the outbreak control measures are put in place, yeah, so hopefully we will be in a better position in the next few days, with all the partners working together.
Thank you.
Any questions from Blackburn?
Yeah, just looking at the numbers today, 14 today, we had 44 yesterday. Was that, it can just be fluctuation? I know there was some system errors earlier in the week. Would you say that that is a accurate number, or would we be expecting some other ones being reported?
Well, we are not aware of any fluctuation for the number that we reported today. Some of the previous increase, it's explained by the outbreak with the shelter population. That was driving the number, because overall we've got a large number of cases that came from there, including the staff and their guests. But other than that, from the outside of that outbreak setting, I think the case counts are still fairly stable, around between 20 and 30-ish, and hoping that trends continue, and we continue to bring our active cases down. We continue to keep our community safe, but we may see some odd fluctuation, and if it's not explainable, then we have a problem, but at least this fluctuation is explained by the outbreak that we are seeing in the shelter population.
Okay, and just a different topic, reached over 10,000 people that have been fully vaccinated here in Windsor-Essex. Just talk about how it feels to reach that milestone, and how you're pushing forward for, it sounds like a big number, but we still have a long way to go, I guess.
Yes, absolutely. So I think both myself and Teresa, we were actually very relieved to make sure that we have done everything that we could to vaccinate our long-term care home and retirement home residents. That's the most critical population that we are dealing with in our community. We are aware that we still have lots of seniors living in the community that are elderly, and that they're fairly mobile and healthy and active in the 80+ category, in the 75+ category, in the 70+ category, and we want to get them vaccinated too. So I think that's even though 10,000 is a overall good marker for our community, but we also want to make sure that we distribute the vaccine quickly, and also quickly to the right people. And that's what we are trying to work through, using a number of approaches, different models, all in to find the best ways to leverage our existing partnership, existing resources, and get them all vaccinated. We are still anticipating that there are some supply challenges with the vaccine, and as soon as we are getting more vaccine, our team will be ready to start vaccinating. Windsor Regional Hospital, we are working together very closely. We are having almost a daily conversation on many of the ongoing issues to further refine our target population, discuss approaches, how do we get to them, and we'll continue to do that. And I don't know if Teresa would want to add more to it, because a lot of the work, time that Teresa is spending today nowadays is on the vaccine front.
Well, just to add that we are happy as we see that the 2-dose series is being completed. So we know that today is Thursday, and we're at our, giving second doses to another retirement home, and then we'll have completed all of the homes. We have a little over 200 residents that have not received their first dose yet, and that number, I think about a week or so ago, I reported around 400. So we have been slowly giving out first doses as well to get everyone caught up in the long-term care and retirement homes. So it is a good feeling. We're working closely with all our community partners on the vaccine rollout as we look at the different stages and phases and different ways to make sure we get the vaccine to the appropriate people, whether it be a mobile team, the mass immunization clinics, so we're always anticipating what's next. And again, depending on the vaccine, and we're working closely with Windsor Regional Hospital as well. And, things are moving and changing every day.
Thank you.
Any further questions from the Windsor Star?
Sure, I know the answer to this one already, but 9 deaths reported today. That would have been deaths that happened over the last several days. Is that correct?
So I did look at the dates, and one of the deaths was as early as the 13th. So I would say the 13th until yesterday. So, yeah.
Okay, thank you.
Any further questions from AM 800?
No, thank you.
CTV?
No, thank you.
CBC?
Yes, I do have one. Teresa, I'm wondering if you can expand on what goes into choosing a site for mass vaccination, some of the factors that are being considered, and whether these vaccination sites will be in both Windsor and the county.
So when we're looking at mass clinics, so this is when we have enough vaccine where it'll be readily available to all of the residents who are either over 16 or over 18 years of age that want the vaccine. So when we talk about the mass immunization clinics, that's, at a time in phase 3 when it's readily available. So we're talking about big clinics. That's very different than our mobile teams going out and, doing a couple hundred people at a retirement home. And so we will continue to do mobile clinics. So in the overall decision-making for where the mass immunization clinics will go, we have again worked with the expertise of our epidemiologist, and he mapped out areas in the city and the county that would be best suited for a mass immunization clinic based on not only where COVID cases are, but where populations are that would be able to easily access the clinics in their area. So right now, and we have met with the municipalities, and we're working closely with the city and the county, and had a really good meeting yesterday where we were presented with the actual layout of what a mass immunization clinic would look like for Windsor and Essex County. And the intent is that the Sportsplex, we know Windsor Regional Hospital has the Sportsplex right now, and they also have the site at the old Windsor Star building downtown through the University of Windsor. So between those two sites, we're assuming that is one site. It'll be downtown, eventually probably moved away from the Sportsplex, so that'll be one site in Windsor. The other, we anticipate another site in Windsor. Yesterday, we were only provided with a general layout that we could replicate in the different mass immunization clinics. So wherever that one lands, will be based on the data and making sure that it meets the needs of Windsor residents. And so in the county, in the county, we're looking at 2 sites and possibly a third one based on vaccines. So we want to be ready to ramp it up if we get lots of vaccine. And so they are looking at a couple sites for sure. So we're looking at possibly 4 accessible sites across Windsor and Essex County, 2 in Windsor, 2 in the county, possibly a third one in the county, and the ability to ramp up in Windsor if needed as well. It will, it's dependent on the vaccine, but also we're looking now at staffing the clinics appropriately. So we're, happily having the conversations with the municipalities that will be helping to staff some of the non-medical roles in these mass immunization clinics. And as you know, we're working on the medical role. We have nurses already. We've been working with nurses who vaccinate all the time. And we are just ramping it up with our HR department's very busy, and we are probably looking at a good 40 nurses that will be able to immunize. These mass immunization clinics, the plan that we saw yesterday, it looks like it kind of functions with 8 vaccinators at each site and with a 12-hour day, 7 days a week. So in the next little while, we'll be, finalizing all of those plans, and we'll likely do a big media release when everything's been settled on, and we're able to give you, really concrete information. We don't anticipate the mass immunization sites will be up and running or needed until probably later. I'm going to say maybe set up for April, and we'll see when the vaccine comes. But based on what we know right now, it's kind of the very, moving target of a timeline.
Thank you very much.
Any further questions from Blackburn?
No, thank you.
Thank you, everyone.
Thank you.